Hello, everybody, and thank you so much to be there with us. We are so glad to electronically welcome you on the Froggymouth studio here in Paris. As you start to be used to, we are every 2 months organizing for all of you, the Froggymouth users from all over the world, one great lecture with a very specialized lecturer that we appreciate the work, that is using the Froggymouth for a long time, and that we really want you to see what they are able to do with this device. What matters for us, really, on the global philosophy of the Froggymouth is to say that once again, there is no cooking recipe to follow when you are using the Froggymouth. Froggymouth is a tool, a wonderful tool, a super powerful tool, but only a tool. What is the most important is what you are doing with this tool. And that's why, to give you insights, ideas, we decided since 2022 to organize a lot of worldwide online lectures where practitioners are coming freely with no instructions on what they are going to speak about, to just share with you what do they do, what is their protocol, so you can take a little bit on each and create your own protocol to create your own use of the Froggymouth. By the way, you can go on the Froggymouth YouTube channel to watch in replay all the previous lectures that has been made for the last 3 years, and that are all available online, at least in English, and for some of them in 4 to 5 languages translated. Today, we are welcoming a doctor that I am really so happy to welcome here in Paris. Even more being an Italian doctor, and everybody that is following Froggymouth for a long time is knowing what special link is Froggymouth having in Italy, being greatly used and having a lot of great key opinion leaders that published a lot of scientific articles. I am especially thinking about Dr. Menzini, that was the first Italian doctor to publish on the Froggymouth, but also all the following ones, Dr. Di Vecchio, Professor Quincy, Antonello Pavone, Dr. Libertucci, all the Italian doctors that helped us to make the Froggymouth growing. But today, it's Dr. Gioacchino Pellegrino that I am so happy to welcome here in Paris. He is going to speak to you about the use of Froggymouth, especially applied to the interceptive orthodontics. Because Dr. Pellegrino is specialized since a very long time in early orthodontics, pediatric orthodontics, not only that, also the TMD disorders, but having a great focus on the interceptive orthodontics. He's, for example, one of the founding members of the Italian Society of Interceptive Orthodontics, as much as the Academy of Holistic Dentistry, and probably following associations that he will be able to continue to create during his career. But I will let Dr. Pellegrino speak to you directly about that. To give a quick introduction, Dr. Pellegrino is really lecturing from all over the world, traveling in Asia, in Africa, in America, in Europe, to be able to present his work, also being a key opinion leader for the LM activator for a very long amount of times. He's running a private practice in Caserta, so in Italy, being graduated from the University of Naples and lecturing at the University of Naples and the University of Foggia. He published many articles that you are able to find online if you are looking on ResearchGate or PubMed. And today it is for his use, for his experience about the Froggymouth, that I am so glad to welcome him here. We are live from Paris, from the Froggymouth studio, from the Biotech Dental Ortho Group studio as well, because for the ones that do not know Yet, Froggymouth team joined the great company of Biotech Dental, really known worldwide, and we are very glad to now be part of this division only dedicated to pediatric orthodontics. They are really having a great focus on this idea of early treatments, and I was having the chance to be named by Philippe Véran, the president of Biotech Dental, VP of the early orthodontics. It is just to give you a little bit an idea of the focus that they are giving on the interceptive treatments. I do not know many places where there is a division dedicated to that. And it's exactly in this philosophy to continue to promote the idea of early orthodontics, interceptive orthodontics, and functional way of approaching our profession of orthodontics that I am so glad to welcome you. Dr. Pellegrino, please, I am leaving you the floor. It's your turn.
Hello. Hello. Thank you. Thank you to the company, to Biotech, to the Froggymouth company, and especially to you, William, because this story and this speech this night in France was born several time ago, discussing on the web together about our experience and our approach to early orthodontic treatment. And we found a lot of common points. And I just want to start from the concept that I am a dentist, and in particular way, I'm a specialist in orthodontics. So my daily work is the work that all of you daily do. And I have the same problems, the same questions to decide what to treat, which kind of malocclusion needs to be treated, and which is the correct timing for each one of these different occlusal manifestations of the groove. Because each one of these pictures shows to us that the teeth are not in a correct position, but the muscles, all the soft tissues of the face are not working well. And we will see this night that there are several protagonists in this story. And we need to know when to treat, because this is really a very important point, to start early or later, and to use or not to use the opportunity of the spark to treat, to approach some malocclusion. And in this case, which is the best solution and the best timing. Moreover, each one of us can use different devices. We can start from the brackets, the aligners, but a lot of removable plates and other functional, a lot of functional devices. And each one of these is able to work properly in our hands if we know the scientific and the technical background. But we are always concentrated and we are thinking always on devices that are able to work on the teeth, on the bones, on the hard tissues. So before to go on in this presentation, I tried to define in my mind 4 points. The first one is that the functions and the morphology are like mom and papa, the mother and the father, and of what? Of the orofacial groove. And how can I approach, how can I manage the orofacial groove? I can manage this from orthodontic point of view using the orthodontic device. And in my experience, I am working from a lot of time with the category of the orthodontic device that are the eruption guidance appliances. On the other side, we have all the myotherapy, all what we can do to rebalance the oral functions and the muscles. And this means that we need to work with exercises, or we can work using some support, some orthodontic device. And this is the reason for which actually I try to combine these different elements, the Froggymouth in the functional approach and the EGA to move the teeth and to correct the teeth. But this is only the first point, because the second very important point, much more theoretical, is that these two aspects, the morphological and the functional aspect, are under the control of the genetic information. But this expression of the genetic information is conditioned from the environmental influences. So we can say in English that genetic and epigenetics are like apples and pears. The third point that again is still very important is that we, all of us, like orthodontists, like dentists, we are very more concentrated on the device. Which kind of appliance do you use? Which kind of technique are you expert in? But we have to consider that it is not only important the appliance, but all the biological concepts that are behind this appliance. And the last point that is at the base of this discussion is that we are really focused on the hard tissues. We use pictures, we use X-rays, we use the STL of the dental arches, but we look, but we don't analyze, and we don't have a criteria to analyze and to approach the soft tissues. And this is a very important limit in our work. So I just want to consider that all our work from mechanical point of view, where it's clear that I will use force, I will apply physical law to move the teeth, to control the growth of the bone, but at the same time, the same rules are present and are conditioning the soft tissues. And this is something that we need to consider every day. So we have to think that to approach malocclusion in early time is a story of growth. So it's important to analyze this story. It's important to consider that this phase, the phase of a child, will grow in 3D and will become the phase of a young adult. And this happens under the condition of the genetic information and of what we have in the around in the environment. And it's a story of teeth, of the evolution of the teeth, because it's important that the growth of the teeth can explain, can express the final result of the occlusion. So we need to understand the morphology and the morphogenesis of the occlusal surface, of the position of the teeth, and at the same time of what happened from skeletal point of view. And it's important to find this problem early and to treat when there is the indication in the correct way. But remembering that while we are looking to the bones, to the hard tissues, the soft tissues are continuously growing and moving and conditioning all the system. And this is something that it's really complex to be managed, because it's continuing interference, continuing interchange between genetic information and environmental information. So if we want to approach all this in the correct way, we need to know and we need to apply to our daily practice the biological concepts that are behind what we do. And after all this concept, why at the end I was interested in Froggymouth? Mainly for two reasons. The first one, because using a lot of removable appliances that work mainly during the night because of work with the growth of the dental alveolar sectors, while I'm using this device, I have some cases that are wonderful and some cases that are not so good responder. Or in some cases, I have relapse. Moreover, I was trying to better interpret, to understand the relationship between the morphology and the functions, in a particular way in early orthodontic treatment. And it is not easy. And so I started to approach this device, trying to design in my mind which is the normal development in morphology, and at the same time, which is the normal development of oral facial functions. And what happened from this normal development, we have a deviation to a pathology. So again, in my mind, I have to apologize, but my background is a bioprogressive background. So in my daily work, I try to create always a flowchart. So in my mind, I have a story of a primary dentition that is in a growing phase in 3D, that a long path in a lot of years will arrive to be an occlusion with permanent teeth in a young boy or girl with the final structure of the face. And in this story, in all this story, we have that the genetic information is behind and is expressing constantly, is the project of this path. But all the local environmental factors can condition this and can develop different kind of malocclusions. It's experience of each one of us. For example, what happened in an oral breather, or in a child that is thumb sucking. But the really important message is that this is true, but we, with our devices, with our knowledge, can be one local environmental factors that can condition the system so to avoid to create a malocclusion. And what to treat? We can find an answer, for example, on the web, on the American Association of Orthodontics, in which we have a lot of indication: anterior and lateral crossbite, growing, incoming crowding, open bite and deep bite, protrusion of upper incisors, increased overjet, tendency to class 3 grow, diastema, oral habits, but this information, this indication as improving during the time. Now we have that the bad eruption of the teeth is another indication. And what happened, that which is the best time for all this, around 7 years of age. And we will see that around the range between 6 and 8 is particularly important from some biological moment. And this will be important not only for the morphology, but for the functions, for the oral functions too. So we have to imagine that when we analyze a malocclusion in a child, we are in a dynamic process. We are looking a moment, a frame of a story. And in this story, we have that the morphology and the functions are the protagonists. In a normal growth, we will have that along this timeline that I designed, because so that I can use this timeline in my office when I arrive a new visit, for example, at 8 or at 5 or at 10 years of age, because I can immediately put that malocclusion, that occlusion in the exact biological moment of the growth. When everything is normal, I can have a normal growth from primary dentition to permanent dentition. And inside this normal growth, I will have that the morphology will be correct, but the oral functions need to be well balanced. And behind, in this situation, normally there is no very important genetic information. But can happen something of different. I have always my timeline, always from 5 to 17. And why to 17? Because 17 is the end of the vertical growth of the face, is the end of the active growth of the dental alveolar processes. And along this story, if I have malocclusion that starts in primary dentition, this will go on in early mixed dentition, late mixed dentition, and permanent dentition. And in this situation, the oral functions will not well balanced. So I have the morphology and the functions that are altered. And my therapy can be done in different moments of this long story. And we have that this situation is not so simple, but we can have a mix of all these aspects. And the important information is that when we have a switch from a normal occlusion to an altered occlusion, and this means to alter the functions, we don't have a self-correction, but we have that the alteration is improving and improving and improving in the bad direction. And we can approach here, we can treat in different moments, but we need to remember always that we need to balance the morphology and the oral function. Otherwise, we don't have a stable result. And again, the therapy can be done, can be used in different moments using different devices. It is not really important, the device, but the use that we can do with the device in which we are expert. But normally the dentists want to see the teeth. So stop with the words, written words, and go to see Alessandro, 5 years of age. So it's really a good time to manage the morphology and the function. What happened with Alessandro? That Alessandro has a story, potential story of a class 3, because the mother presented a tendency to a self-compensate class 3. But at the same time, it presented a transversal deficit, some incisors missing, snores during the sleep, and he eats only few foods, no hard food in the diet. Why this is important? This is really important because the diet is the gym. It's important to train the muscles. And the modern diet that is connected with the soft foods doesn't help the training of the muscle. So this is every day a very important problem in my work. But look at Alessandro. Normally, even I do an early treatment. This is an orthodontic treatment, so I will use the picture of the face, the X-rays, the STL of the dental arch, and so on. And if we look to the face of Alessandro, there is a deviation of the mandible. We can see is not so cooperating, so it's really very difficult to maintain quietude, but we can see that the mandible tends to go forward, to be protruded, and the most important information from the occlusion is that he is not able to have a stable occlusion. So imagine what this means for the working way of the muscles, not to find a good relationship. He needs to put the mandible laterally or forward to arrive to work in some way. And this is a morphological and functional working way, a tendency of growth that is not correct. So why to wait? Why don't treat? And why don't treat from morphological and functional point of view? And this is the reason for which I have a combination of the use of Froggy that in my mind is approaching the tongue, the lips, the mentalis, the orbicularis muscles, and at the same time working nighttime with a removable device, an eruption guide appliance that can modify the dental position. So to combine the orthodontic therapy and the myotherapy in the same time with a good strategy. What happened? That in few months, we have a completely different relationship between the arches. We have a stable occlusion, and this means that it can start to work in a different way. And in this moment, it's not really important, the missing teeth, but it's important that we have that the molars and the incisors are erupting. Why? Because we have that the eruption of anteriorly, the eruption of incisors, and posteriorly, the eruption of the molars will create the 3D support of the occlusion, will define the inclination of the occlusal plane, and will give the information to the TMJ to develop in this direction. Going on with the growth, we can see that the teeth, the lower incisors are erupting, and the occlusion is going in a better, not ideal, but in a better relationship. And when you have a situation like this, please extract as soon as possible these primary teeth, because in this growth tendency, it's really very important to consent to the upper incisors to go forward, to erupt forward in the correct direction of the plane of the creating occlusion. So we can see that we have a really stable occlusion, and you can see here that he is working better, but you can see that the muscles of the face are in some way creating some interferences. I use normally these short videos just to analyze what happened in this area. And the fact that he's not able to stay in one position for 1 minute explained to me that all the activity of the body is really very extreme. And it's clear that it is not only a problem of occlusion. And from morphological point of view, we can see that the results are better and better. And now I will need to go on with the therapy and to manage the missing teeth, the spaces, and so on. But now it's stable. And the overbite that I reached is able to use the power of the growth of the mandible to put the upper maxilla forward. And this is a sort of a summary of what happened during this therapy, during this growth, using the EGA nighttime from 8 o'clock p.m. to 7 o'clock in the morning. Why? Because the eruption of the teeth is active from 8 o'clock p.m. to 2 o'clock in the morning. So the nighttime is very important if I want to manage the morphology, if I want to condition the morphology of the dental-alveolar sectors, and in this way condition during the time the position of the bones. But during the day, I use 30 minutes, and later we will speak about how many time I use during the daytime, the Froggymouth. So in this case, I use it for 30 months, 30 minutes every day. But you can see that the story is longer because I need to unlock, I need to go on with the therapy so to arrive to a situation in which I can have a stable occlusion and to have a rehabilitation of everything. And here you can see how, using the combination of these two systems, I can have something really very interesting, because I can have a development of all the arches, and I can have the development, the change of the profile during this time. And here we can see how the occlusion is trying to find itself a better relationship. So I tried to design, treating these cases, the essential milestones in a child after oral growth and facial development, to define which is the rule, to try to understand which is the rule, and to see that during the eruption of the primary dentition, what happened? That we have, in the first moment, the eruption of incisors. So we will see always deep bite. And this deep bite will disappear when the primary molars will erupt and will open the occlusion. Remembering that we will have a vertical growth of this part of the face, and at the same time the mandible will need to constantly have a rotation to compensate this vertical growth. So if we look what happened in this primary dentition, we will have that there will be defined the occlusal plane, and the eruption in particular way of the first molars, permanent molars, will condition all this process. And the increase of the vertical dimension is strictly connected with the rotation, with the mandible forward adaptation. And this is strictly connected with the morphology of the TMJ and the working way of the TMJ, because there is a strict relationship between this area and this area. And this is the reason for which I really believe that it's important to give the correct position to permanent incisors and to the first molar, permanent molars during the eruption. But this is not enough. I can reach a good morphology, a good spatial relationship, but I need to have, at the same time, a good balance of the oral functions. And so my aim is to try the way to arrive to balance oral function in combination with a balanced occlusion. And this is the reason for which I designed a new different timeline from 0 to 6. Why? Because I tried to define, to make a sort of summary for myself of what happened from functional point of view. So when we are born, the first thing is to breathe, but we start to swallow immediately, or if we reflect, we start to swallow before we are born. And it is not important which is the most important function. It's important the relationship between the different functions. And it's important that when one function is not working well, the other functions cannot work properly. And on the contrary, when we will improve one oral function, we will have a constant improvement of the others. And this is important. Why? Because today, our modern life is much more complex than in the past. It's much important to have time, because no one of us have time, neither our child. They are so busy every day. So coming back to this slide, I think that it's important to remember that the first thing in which we hit is to have breastfeeding. Later, step by step, after some months, we will arrive to swallow in a different way. Why? Because we started to chewing when the primary molars appears in the mouth. So this is a very important strategic moment because we needed to have a change, a shift of the pattern. We needed to work in a way in this moment of the life, and then we needed to change our functions during this time. So to arrive at 6, that everything is perfect, is in a perfect combination. And all this summary is just a global view on what we have to remember that happened constantly during this year in the relationship between the oral function. And this is the normal development. It's what happened normally. And I tried to do something different. I went on my timeline and I put on the upper side all the morphology and the lower side the oral functions. So I know that at 6, the 80% of the anterior base of the cranium is completed. And I have that later arrive, here arrive the teeth. I have the lateral increase of the upper maxilla. At the same time, there is all this system that is improving. I go on with the grow, and I have that there is the transversal and anterior posterior grow of the mandible, of the ramus, and of the corpus of the mandible. And this is possible only if everything is working properly. So we have that during this story, in which progressively the teeth will arrive and the functions will change, we will have that everything needs to be in a perfect synchrony. Needs to be like a watch that is working perfectly. And in this situation, I have that the Froggymouth, in my experience and in my hands, can be very useful when this project is not developing well. And around 4 years of age, between 4 to 6, I can use the Froggymouth alone to have a rehabilitation of the relationship between the different oral function, but we will see why. Later, if I go I arrive in the range between 6 to 8, what happened that I will have the eruption of incisors, the eruption of molars, and the 3D relationship between upper and lower arches is creating, but not only. At the same time, I have still a continuous, a progressive increase of the vertical dimension. And during this increase of the vertical dimension, the mandible will tend to compensate this vertical growth with a forward rotation. And the teeth are exchanging. The dimension of the lower part of the face is increasing. And the TMJ is defined its structure and its working way. So this is another very important moment in which the define of all this morphological aspect needs to be in strict correlation with the functions, with all the system. Imagine that during this process, during this year, the occlusal plane will grow in this way, will have this rotational pattern because the ramus will grow vertically and the mandible will tend to go forward. So if I want to make a summary, a flowchart of what happened between 6 to 8, I have that from morphological point of view, and again, it's in the upper part of the screen, I have that what happened in the hard tissues and soft tissues. That I have that the cranial basium is completing the growth, the upper maxilla is growing forward and downward. At the same time, the nasal cavity is growing, but I have again that the mandible is increasing to maintain the relationship with the upper teeth. And at the same time, we have that the tongue is increasing the sides. And at the same time, we have that bone, height bone is moving forward and downward. And the tissues, lymphoid tissues, are in some way growing in correct relationship with all the system. From functional point of view, we are at 6, so theoretically, everything should be working well. But if this doesn't happen, we have that the system will go to not be in balance and will appear more and more complex malocclusion. And in this case, which are the opportunity? I can have a lot of way to approach with surgery, or my functional therapy, or expansion, or to manage the nasal breathing, unlock the overbite, or to manage the dental eruption. So I have a lot, really a lot of opportunity. Which one is the best? I think that doesn't exist the best one. I think that the best one is the best way in which we are much more confident, much more expert. Between 8 to 12, we have again that something else happened, because we have that the lateral sectors are erupting, change the occlusion in the lateral sectors, and in this time, the dimension of the tongue is arriving to the final definition. Even if the power, the energy that the tongue is able to define will increase progressively until up 18. But we will see this soon, because it's interesting to see that at 8, when it's defined the 3D relationship between the two arches through the eruption of incisors and the first permanent molars, it's a moment in which the tongue and the soft tissues will arrive in a maturity, in a structural maturity that will modify itself in a specific way. And again, I can do a lot of different therapy. And if we are orthodontists, or in general, if we are dentists that we work in the orthodontic field, we are able to find different solutions, because it's what we do every day. What is perhaps missing in our vision is that we don't need to be concentrated all in the upper part of the screen, but we need to think what happened in the lower part, and how our therapy on our management of our patient can modify the lower part of the screen, the oral functions. And again, from this point of view, I think that during this time, the use of a Froggymouth alone can be a resource, can be something of useful, but I think that during this time is much powerful the combination of an orthodontic device, and in my heads I use the EGA, and in combination during the day with the Froggymouth. Why the EGA? Because the EGA performed or customized represented an advanced interceptive orthodontic device. So to manage from a biomechanical point of view the occlusion using the biologic concept, and arriving to be able to have a 3D control of the occlusion. But these appliances are able to condition the dental-alveolar sectors, the dental-alveolar processes, and to change the way in which there is a contact between the upper teeth and the lower teeth. Imagine what happens if we have an anterior crossbite. The occlusion will be completely different if we have a class 2 division 1, in which we have that the message starting from the occlusion is completely different. And these messages, through the receptors, create a system, create an answer through the muscles. And there is a close relationship between the skeletal development of the jaw and the dental-alveolar complex. And the dental-alveolar complex is the area, is the sector of the mouth in which our devices, our orthodontic devices, are more able to work. I think that I am able to change the position of the teeth, but in my hands, my experience is much more complex to modify the morphology and the position of the mandible or of the upper maxilla. But modifying the dental-alveolar sectors, we will modify all the area in which the roots of the teeth are inside. And this area that is very responsive to our different devices, during the time will become basal bone. And so if we work early and we treat, we manage, we guide for a long time the occlusion and the working way of the occlusion, we can have a change, a rehabilitation of the old system. And behind the eruption guide appliance, we have some biomechanical concept. For example, the eruptive forces, the importance of the mechanoreceptors, the different thickness that we can use inside the device to modify the inclination of the occlusal plane, the different materials that we can use to obtain this result, the resin or the silicone or other kind of materials. Why it's important to create a relationship of class 1, and in which way we can reach a class 1 relationship using the biological concept of the growth. And at last, but not less important, the morphology of the different devices that will guide the tongue in a different postural position and will stimulate the activity of different areas of the oral muscles to reach a good result. So, in my experience, the first step is really very important because we have that the teeth are erupting in 3 different moments. We have the pre-eruptive stadio in which the crowns are inside the bone. And later we have this area in which the eruption of the teeth is active. The teeth arrive in the mouth, we can see them, and arrive to the occlusion. But what happens when they arrive to the occlusion? At this point, the eruption is not stopped. This process will go on actively until I'm 17 years of age. And in this moment, all this growth and the occlusal forces are really very important to manage the post-eruptive activity. And the information that start from the periodontal area, the mechanoreceptors that are inside this area will condition the answer, the working way of the muscle, and we condition the soft tissues. In this process, the tooth movement is to be considered a key part, an essential part of the facial growth, during is a 3D activity in which through the stimulation of the dentoalveolar ligament, there is a full activity and full control of the bones that is around. And one concept that is very important is that the eruptive forces is small. And this message is important because to control the eruption process, we need to manage small forces through the appliances or through the activity of the muscles. So we don't need to have a lot of exercises that develop extreme forces. We need to develop a soft stimulation so to manage this process. And this goes through the mechanoreceptors and the mechanotransductors. And this is a very important slide, because everything of what we do changes completely. If we look from biomedical and bioengineering point of view, what is connected with the functional matrix hypothesis of Professor Moss that you know, I'm sure, and this is connected with this paper. But these other papers show to us that these were published more recently, explain to us why we have the results every day with our appliances and why we can have results modifying the information in the mouth and the working with the muscles too. And so this cellular aspect becomes to arrive to explain to us what happened during the treatment, what happened when we have a relapse or when we have stability. And this process is really very important. And in this condition, we can use from mechanical point of view, the EGA, and from functional point of view, the Froggymouth. Working in this specific way with different thickness, so that in this area, I have a full information of the message. There is a touch and there is a specific message. Here there is no touch and there is a different message to the system, so that the cells in that area will work in a different way. But the EGA are able to guide the tongue in a correct position, to support the tongue to go to the spot. The spot area is important because the stimulation of this area, maintaining the lips crossed, can create a very important stimulation for the global answer. And the morphology in general of DGA presents a surface that can guide the tongue up where the palate is completely free. So we need to find a balance that it is not simple to reach and to maintain during the time, during the growth that we have seen. It is a very active process. This means that I need to try to arrive to a situation like this, in which the posture of the tongue is correct to press constantly on the upper maxilla, and not like this, in which I lose the potential forces that can normally develop a mouth. Because in normality, in a normal growth, we don't have orthodontic devices in the mouth. And all the morphology of the arches, the curves that we have, the values of overbite and overjet are connected with completely different position of the tongue and completely working way of the tongue. We have that ideally the tongue should start in the movement pushing in the anterior part of the palate, in the spot area, and needs to go back pressing under the palate, in particular way in the lateral sectors of the palate. And this is important. It's important to understand how this gym, how the muscles, the tongue, can go to the gym, and how our devices can be a sort of gym to stimulate the growth of the upper maxilla and of the mandible. Because you have to imagine that when we have a situation like this, with this kind of activity of the mentalis, of the orbicularis muscle, it's impossible to have a good morphological relationship. And we can test, for example, using the fluoresceina, we can test where the tongue is pushing during the activity. But we need to analyze where the tongue is during the rest position, because it's a long time. And during the rest position, is able to develop a soft, continuous force on the bones. And these forces are like the forces that we use in the orthodontic approach. And this will consent to develop the arches in a correct way. I remember, this design remember to me the Roman arches. Everything is very stable and very resistant to the force, contrary in this situation. And this is a situation in which we have crowding. We have not a good relationship between the arches. So we need to have a relationship with oral posture and tongue posture. And it's important that there is a constant stimulation of this area. Why? Because we have a lot of different quality of receptors that needs to be stimulated to work properly. And this means that we need to analyze it, to understand what happened at rest in the relationship between lips and tongue, and what happened at work, in activity. In activity, the forces that the tongue is able to develop is much more important. And at rest, it's important that the tongue is able to push in this way correctly on the upper maxilla to consent to the development of this bone and to consent to the development of a nice balanced face. On the contrary, we have something that is completely different. And the muscles will work, the facial muscle will work in a completely different way. We have that so that this balance needs to be considered important. And it's clear that in our mind, the incisors are a sort of a balance, a sort of indicator that say to us the balance between the centrifugous forces and the centripetal forces, the forces that goes out and the forces that tends to go in. But this is not so simple, because we have that the tongue is active, increasing the pressure during the activity, and we know that the forces of the tongue is becoming more and more important going in the back. So this explains to us why we have expansion, a natural expansion in the upper arch. And these forces is, this direction of the forces is the same in the different position that we can have during the day and the night. And it's interesting to see in the literature that we have that at 8, in a normal occlusion, the tongue arrives at a very important ability to develop forces. And these forces will increase until up 18. 17, 18 is the end of the vertical growth of the face. And the same study, the same analysis needs to be done on the cheeks, on the buccinator muscles, because the increase of the forces that are very low at rest, in particular way, increase during the activity, but increase a lot when there is a different and not correct working way of this area. And this will condition the lateral expansion and in particular way the position of the canines. But it's important to reflect on another aspect, because during the life we have that the pressure of the tongue from inside tends to be always a little more important, wider than the pressure from outside to inside. So if we think to this process, we think we should consider that all the teeth should go forward all life long, opening spaces between the teeth. But we know, on the contrary, that after 8 years of age, the arches will reduce themselves, and normally crowding will increase. So this means that it is not so easy, a so easy balance between the tongue and the lips that determine the position of the teeth, but it is a more complex system in which we have all the anterior balance, in which we consider the different activity of the muscles inside this process, in which when we have a not working way, we have that the pressure will increase a lot, condition in particular way the position of the canines, but in general of the lateral sectors. And this happens when we use, for example, pacifiers. So it's important to think about this, to understand until up which moment of the growth during the summary that we have seen before is possible to work in this way or not. And all this situation will condition the posture of the head to match this situation. Alessandro is a young guy that arrived in my office in this relationship, in this situation of the dental age. He was not able to eat hard food, and he had a really bad occlusal relationship. And he is working in a correct way, but working on the occlusion, the position of the head is changing, the position of the teeth too, and we can see that working in this direction and using different strategy. For example, here in this situation, I use a few centimeters of elastic channel to change the proclination of the lower incisors to work properly with the orthodontic device. I can see that using the Froggy and using the EGA during the night, everything changed, and the occlusion changed. Even if I know that in this situation, in which I have more stable occlusion, a control on the anterior area, but I have that the tongue is not still working properly. So I need to go on with the therapy to manage this. This is the reason for which I was saying to you in the beginning, I arrived to use the Froggymouth because even if the EGA are able to work on the functions, in some situation it is not enough. And I need a more powerful tool to increase this effect. And this is because the muscles are really very important in all this concept. And the link between the muscles and the occlusion, in particular way, the receptors that we have inside and around the teeth and inside the TMJ are really very important from this point of view. So that we can consider the tongue like a natural conformer of the growth of the upper maxilla, and it's clear because there is a direct pressure of the tongue on this structure, and at the same time of the mandible. Why? Because the correct activity of the mandible is supporting, is stimulating in the correct way the direction of the growth, the correct working way of the tongue is stimulating the correct growth of the mandible. And so the occlusal hemostasis cannot be simply this kind of situation, but it is something of more complex of this system, in which we have to consider that in general the lingual force is wider than buccal forces. And the occlusal hemostasis needs to be considered with all these different factors that will influence the clinical result, what we can see in the mouth of our patient. And these factors are really very different and important. But this process, this complex system, is a system that is very dynamic. And we can come inside this activity with our appliance, with our technique, if we know the working way of this system. So how can I work in this, and why the Froggy can be useful in my work? I started with the no-responder patients, with the guys that are not able to give me a very interesting result from clinical point of view. So the cases in which in my mind I was able to correct some part of the occlusion, but I was not able to unlock from functional point of view. So I started from the concept that the lips are the key to this kind of rehabilitation, and through the lips arrive to the tongue. So to modify the relationship, the position of the tongue in the mouth during the activity, but during the rest position too. So to change this system. And I started to use the Froggy because I was able to read some papers published of some friends of mine, like Stefano Di Vecchio in Rome, that showed that it is possible to obtain good results in a large number, not in the totality, but in a large number of cases. And behind this result, there was a scientific concept. There was a way to explain why these clinical results were possible to be reached. In particular way, in my approach, was very interesting why the neurophysiology was able to explain this working way. So I started to apply this concept not only to the Froggy, but to the other orthodontic device too, to use this stimulation. And in particular way, was very interesting to use the concept of passive rehabilitation, because the patients that I treat are so busy that I needed to find a way to give them a solution. Short time during the day, wide result. When I use the Froggy, I use the Froggy in different situations. I can say the open bite, deep bite, lateral cross bite, and so on. But in general, I think that I use the Froggymouth when, in all the situations in which I have the feeling that the soft tissues and the muscles are not working properly. And for what I use it? I start to work for swallowing, but I know that all the functions are connected. And I try to rebalance the speech, the breathing way, and the head posture, so that to have a management of the facial development, and at the same time to try to have a new muscles balance. How do I use it? Normally, I use it 15 minutes per day, staying in front of the TV or the PlayStation for 10 weeks. Why? Because the research says to me that this is not a correct position, that's fine. And this study of the University of Lille explained that I can have an efficacy of 80% after 10 weeks of treatment. So my protocol is this. But the next step of the protocols are organized in this way. After these 10 weeks, I start to reduce the use of the Froggy. Why? Because in the beginning, I want to reach a remodeling of the muscles in deep memory, so to reorganize the working way. And the next step is to arrive to a stabilization of this result. The next step is to arrive to a muscles reinforcement. So the concept is that I want to use the device and the exercise once a week for 3 months. But I have to say that in my experience, this is invaluation. Because when I say to use the device 50 minutes 1 time per week, I see that my patients don't use it. So we have a lot of support in research. This is a paper by Professor Quincy from L'Aquila that is explaining that we can have not only the balance of the swallowing, but we have a very important improvement of facial mimics. And why this message is important? Because if we have that the facial mimics is rebalanced, we have that the system is saying to us, I am working well. Because when the system is working well, we have no sign during swallowing and during breathing. How many times? At least 10 weeks of treatment, and I need to have a situation in which the position of the head should be correct. And this is a very important problem for me. Because normally they tend to have not a correct posture. And this is a problem to go step by step in the sequence that is important to arrive to result and to maintain, to have a stabilization of this result. So in the beginning, I don't give too much information to the patient. I say, use this is the correct position, and you have to maintain in this way, so that to try to create a discomfort, and to give the opportunity to find by themselves the solution to this discomfort. And during the time use, I explained that it's important to maintain a correct posture. To maintain a correct posture, that is simple to explain. It's simple to explain that it's important that all these factors need to be respected, that this is the ideal situation. But I tried to put the frog in my mouth, between my lips, and to stay 50 minutes in this position. For myself, was really terrible. So I believe that this is really a theoretical position to explain why happen some things. But in daily use, I think that this idea is not possible when I treat young boys like that have a head posture like this, or this, or this. So it's really complicated. But the interesting thing is that I can unlock the system. I can create something in which I give the opportunity to the muscles to work in a different way and to create a new relationship between the lips, the tongue, and in general between the oral muscles, so that to have this working way in the correct position. So I will have the automation, I will have a self-improving system when this balance will be created. And this will maintain everything. So, for example, I think that it can be useful to use this approach even after another orthodontic therapy, like aligners or a therapy with brackets, to arrive to a rebalance of the oral functions, to avoid the relapse. And we can see what happened with Clemente, deep bite, very important deep bite in primary dentition. Look at the position of the chin, of the lips, which is his normal working way, his normal posture. This is the occlusion. We can see how approaching using this protocol, we have that the soft tissues, the relationship between upper, lower soft tissues are changing, but it's changing the occlusion, but not so good, because the anterior bite is still important. So this means that my orthodontic device is correcting, aligning the teeth, is creating a new relationship, correcting the lateral occlusal plane, but the powerful tool to unlock the occlusion and to consent to the EGA to express better its forces is the use of the of the Froggymouth during the day, so that the bite started to open and open again. And what about active exercises? Because today, in my practice, I see that it's very difficult to have active exercise during the day. So I normally don't use exercise, no exercise in the first 2 weeks. In the office, normally I check what happened in the posterior part, in the dorsum of the tongue. Every time during my visit, I press this area to see what kind of answer I have in that area. At home, I normally have I explain to the parents to check during the swallowing what is possible to feel in the lower part of the mouth, because during a correct swallowing, I don't need to feel pressure here. And another very important activity, we can call it an exercise, I suggest to brush the point and the lateral surface of the tongue, because today, perhaps because of the soft diet, there is no information that the brain is able to see, to catch from the position of the tongue in the mouth. So in this way, it's possible to have information and for the brain to understand where needs to change something. And normally about the sides, we have 3 different sides. I think that all of you knows that we have small, medium, and large sides, and change the morphology of the dimension of this device, even if the morphology remains the same. And normally I don't want to have a very important wide. I want to maintain I want to choose the best one that can give a good position, a good stimulation of the soft tissues. Which are the limitations? The age. For me, my hands before 4 years of age, I prefer not to use. Until up which age? I don't know. My experience is until up 17, 18 years of age. But I think that from theoretical point of view, it's possible to manage the oral functions at every age, perhaps with more difficulties in the adaptation and in the stability of the system. One limitation is connected with the morphology of the arches. If I have a very strict upper arch, this is a problem for me, so I prefer to open, to expand before. Or if I have a very protruded teeth with a deep bite. Or when I have a tongue tie that doesn't consent the correction of the functions. Another very important limitation in my experience is a not good level of cooperation from the family. Because it is not only, this means that the therapy is not only to use 50 minutes the device, but using the correct way and to combine to the use of this device the change of the diet, the change of the breathing, the change of all the elements that are important to correct and to maintain the correction in the functional activity. So my time is concluding. Arrived to the conclusion in which I want to share with you that concept that the lips are the key to the Froggymouth rehabilitation. And the aim is to create a functional rehabilitation that can give stability in time. But don't believe blind in experience. It's important to know the theory, and from the theory, think in a creative way. So I'm sure that the future of orthodontics lies in the sophistication of a control input, in regulation of histogenic biologic system through our activity in the oral district. And I hope to be able, to have been able this night to give you the chance to think about this perhaps in a little different way. Remembering that between 4 to 6, the use of Froggymouth consent to have a very important rehabilitation. In a different way, in my experience, I prefer to have a combination of the Froggymouth with other kind of orthodontic device, so to work on the morphology and on the function at the same time, not approaching only the functions, waiting for the change of the morphology. And at the end, I want just to complete with this concept that simplicity is something that is not simple. In particular way today, where we have a lot of information. And this is a concept that is coming from Leonardo da Vinci, where simplicity is the ultimate sophistication. If we know what is complex in behind, we can create something of apparently simple, like the Froggymouth. And this is a concept that is applied in a very effective way in the Italian architecture. And I want to complete my presentation with a picture of my land, my country. I arrived from Caserta, close to Naples. We have the Vesuvio volcanum there. And I have in my mind the concept that the power of growth is a very good servant. We can do a lot of things using the growth, but it can be a very dangerous master. So thank you for your time. Thank you for your attention. And I hope to meet you in person in some other occasion.
We were so glad at the Froggymouth studio here in Paris that we could welcome Dr. Pellegrino to present you this wonderful protocol that we already see make you asking so many different questions about the Froggymouth device and also about concrete use case of this common protocol. Good news, you can ask all your questions right now to Dr. Pellegrino. We just ask you to move from the chats part to the question and answer part so we can rank all the questions and directly ask them to Dr. Pellegrino right now. In case if you have any further questions after the end of the live, feel free to send an email to contact@froggymouth.com and let's move to the question and answer session. Thank you very much, and thank you so much, Dr. Pellegrino, for this wonderful lecture. We were saying that all of you guys on the chat were very interested about the subject of the early orthodontics, and especially we were seeing a lot of questions. I directly start about this aspect that was very discussed. You've been asked if the Froggymouth for the myofunctional therapy in general is working in the same way and is still efficient in case of a lateral tongue thrust, which is very different than the regular tongue thrust that we used to see.
Yes, yes. That's a really very interesting question. You have to imagine that my first approach to Froggymouth was not for the open bite, where we can see a lot of cases and image that we needed to treat the anterior position of the tongue using my functional rehabilitation. In particular way, I approached using to correct the deep bite, because I had more or less 25–30% of deep bite cases treated with my hands that were not responding so well. And the answer was that unlocking this functional block, changing the postural position of the tongue and pushing the tongue up in so that to consent the pressure on the bone of upper maxilla close to the premolars and the first molars, the bite was again opening and opening. So I think that it is, as I was saying before, it is not really important the kind of malocclusion that we say to treat. But it's important to have in the mind that when we have a malocclusion, an alteration of the occlusion, there is always an alteration of the oral functions. And I know that theoretically it's possible to correct only the oral function and to obtain a correct dental position. But I am not able to do this. So I prefer to, because I need to arrive to a result for the people that arrive in my dental office, I prefer to do something of different, to combine the orthodontic world, in which I am much more expert, to try to have a functional rehabilitation in a way that I can explain to people, I can understand, using the Froggymouth. So I suggest to use the Froggy in all the situations in which the morphology is altered and the functions are in evident way altered, respecting the rules that if the morphology is too much altered, I prefer to correct before part of the morphology, so to consent to arrive to a good function for the lips and for the tongue. Because if I have protruding incisors, it's impossible to have that the lips can close.
Yeah, of course.
So that's very easy.
It's very interesting what you are saying, because it's coming back on an aspect that we are often coming back on, especially when my father is lecturing about the Froggymouth, always stating about the importance of what he calls the anatomical environment, to make sure that we are not asking the patient to do something that he's not able to do physically, because otherwise we are throwing him on the wall.
It's an incredible work that people say that the nervous system say, oh, why I have to work much more than normal? I don't want to do this.
Exactly.
On the contrary, we need to create something that consent the system to say, oh, in this way I can stay well. It's easy. I need less energy. So it's the direction in which I want to go.
It's exactly about this less energy part, because when you are using something simpler and a more efficient way, you need less energy.
Sure.
So it's a little bit less is more.
Sure, it's so.
And I think it's also a very interesting way of staying on this lateral tongue thrust subject, because as I told you, many people were discussing about that on the chat. First of all, I really appreciate your way of directly speaking about about the posterior open bite, and the fact that the deep bite is actually just the posterior open bite,
yes,
with a link to the lateral tongue thrust, which is something that we are not hearing often enough, on my opinion, when I listen at Orthodontic lectures. And there is so few questions about this specific aspect on the lateral tongue thrust. And Anne B was asking you if you can still unlock the occlusion on those situations. I think we already a little bit answered, but
I think that the lateral open bite is something that is really much more frequent. But very often we can find a situation in which we have a non-occlusion. It is not a really very important lateral open bite, but a not occlusion in the lateral sectors because of the interference of the tongue. And this is, I think that this is a very important sign connected with the habit of the family. Because in this situation, if you ask to the mothers, what you eat at home, do you eat hard food? Do you eat carrots? Do you eat apples? They say no, because normally today we give to our sons soft food because, oh, they are so nice. Why they have to work with the muscles? And moreover, because it's easier to find soft food, cooked food, sophisticated food, but this creates a lot of problems. So the first step that I always suggest today in early treatment is that it's important to explain to family, to the mothers, that if they want to reach a good occlusion and to maintain a good occlusion, it's important to breathe well, to swallow well, and to eat well. And this is the first step for each orthodontic therapy. And coming back to that situation of a lateral non-occlusion on lateral open bite that are really very difficult to be managed. I think that are situations in which I have a lot of problems to understand why it happened and what I have to do. Because in the past, my idea was, for example, to use vertical elastics on brackets and to close. But what happened? That after some were reopened again. So today, my opinion is that I need to manage the diet, hard food every day, every day, every day, improving the power of the muscles like gym, and to support the rest position of the tongue. And a rehabilitation of this kind of rehabilitation needs a long time. It is not something that change in few months, but needs a long time, at least 1 year, 1 year and a half of support to the tongue and to obtain the change of the pressure.
It's very interesting what you are saying also, like that's about the observation of the familial aspects, because most of the time when something, any characteristic is often coming within the same family, many practitioners are then concluding on the fact that if it's something that several people of the family have, it should be genetical. Because, yes. But if everybody in the family is actually following the same habits, sure. If the whole family is used to hit his face on the wall, you will get scars on the face, not because it's genetical, but just because you are having the same habits. Yeah. And I think it's something very interesting. I often hear about the importance of observing the family, which is totally true, but we should not conclude because something is having a high occurrence in the family that it's a genetical.
But it's clear that if you are round, if you are well round, you cannot die square. But I think that there can be a really wide modulation of the expression of the round or the square. So this means that the genetic message, that the genetic input is, we cannot not consider it. But the genetic expression, and we know this from the medical field, is conditioned hardly by our habits, by the environmental factors. So our orthodontic device are environmental factors, but the allergy, so what we breathe, how, in which way we clean the nose, for example, because we clean the teeth, but we don't have the habit to clean the nose. And what we eat, not only for the consistency, but for the quality, because the food that we use today is a food that is good for fast eater, for the bacteria that in our mouth and the intestine are able to use sugars and gluten very fast. But this creates a change in the immunity answer. So this creates a more important predisposition to allergies, for example, and so to oral breathing. So if you change the diet using less sugars, simple sugars, and less gluten and so on, you can see that the people answer in a completely different way. But moreover, image, and this happens in my office every week, when I ask how many water this child drink during a day, the mother say, oh, a lot, at least five, one, two Coca, and juice fruit, 5 juice fruit. But how many water? Oh, 1 glass in the morning. Perfect. It's not normal, because the rule is not this. Yeah. He needs, or she needs to grow correctly. She needs to drink liters of water, so that it's a complete different message. And normally we consider all this completely away from the orthodontic world. But all these aspects are the basis to work properly in orthodontics, to maintain the result that we are able to do with our devices. Because the orthodontists are able to move the teeth, to correct, and we are able to do something of incredible. But if this remains the same, we will have relapse.
That's very interesting, because I think need to speak more about the importance like that when we are doing orthodontics, and especially orthodontics, to take the time to be able to address to the parents, to involve them, which is linked to the following question that have been asked a lot in the chat. How are you, Dr. Pellegrino, making sure that every patient is actually wearing the device for 15 minutes per day, every day? And what are your little tips to improve the cooperation of the patient and his compliance?
Yes, that's really, I think that this is really a very critical point, because I think that like everything, it is not important to be extreme. It's not important to be so strict in the rule. I think that the message that I try to give to the mothers and to the family, because I think that in this specific way is important all the family to manage this therapy, is that we need to give a different message to the system, and to give a different message that can go deep in the information and to maintain what we want to transfer. It's important that there is the best possible postural position. We need to maintain the neck in a correct position so that the head can be in balance. Image that a lot of these children tends to have rotation of the head, tends to have a lot of small altered position. And to do this, in this way, I suggest to use no shows, to stay up in front of the TV and to look at something that they like a lot. Normally, I use this strategy in other situations. For example, I learned from your father theory, and I use it in TMJ management. For example, in a lot of ladies that I treat that are older, around the 40s, that arrive for TMJ problems, I suggest to use the bite for 15 minutes, 30 minutes during the afternoon, listening the song when they were young and in love. It's clear that this works if they are not divorced, but it works. So I think that it's important, the message that the system needs to be unlocked. To unlock, I give a situation of discomfort, and I need to give a condition, a global condition in which the guy is not thinking, where is the tongue, what I'm doing, but needs to be concentrated on something of different. And the simplest thing is to look at the TV. Because of the age, the cartoons. Yeah. But, for example, to use the PlayStation represent an interesting different way, because for the cartoons, they stay more or less in a static way. In the use of the PlayStation, they are really very active. So there is something that is much more complex to the system. But I don't know if this is better or not, but I think that it works a lot.
I see that you are either a player or the father of a player, that we're observing a lot your son or your daughter playing on the PlayStation and making movements. I can see that. Yeah. We are having a lot of questions. If we are not able to treat all of them today, just to let you know, you may also send additional questions on contact@froggymouth.com, and we will directly share them with Dr. Pellegrino to give you back an answer. I'd like to ask you one question that is also coming back very often, which is, how are you choosing the size of the Froggymouth when you're putting it in the mouth? Pretty simple question, but always very important.
Yes, and this is not a simple question, because I think that I need to create discomfort, but at the same time I need to create a situation in which it's possible to the muscles to find the solution to this discomfort. So normally I test the sides, and I don't want to use the most wide situation, because I want to leave this area free to move it, to adapt. So normally in my practice I use a lot of small and medium, but very few wide device.
I have to say that it's the case for most of the Froggymouth users all over the world. For a long time it was not the case, but years after years, we were understanding the importance of letting the corners of the lips free of movements. And that's why now it's way more the small and medium ones that are sold all over the world rather than the large one. Usually we recommend that the age gap between the small and medium one is around maybe 10 years old for the boys, 13 for the girls. But as Dr. Pellegrino said, it's really about distance between the corners of the lips and not the legal age of the patients.
Yeah.
To close, I will choose not a question itself, but a comment that I really appreciate from Natalia Maklinets that we had the chance to welcome also in Paris last February to make a lecture like you did. Just a little word about that, because Natalia is a wonderful professor at the University Ivano-Frankivsk in Ukraine for the moment, and is continuing, even though the situation is as awful as we all know, to make research, to make clinical research, including on the Froggymouth. And she was publishing a wonderful article about a scientific clinical study that she did and she published with the university on 83 patients, if I am not mistaken, highlighting the fact of having 83 to 85% of success rate on the use of Froggymouth over a 10 weeks period, with more than 3/4 of the patients that are fully automated after the 10 weeks of the treatment, even though, of course, increasing the length of the treatment is always improving the results. If you are interested about this scientific study, we may put you in contact with Natalia Maklinets, or you can just watch in replay the lecture she did about this study last February, or any other lectures in replay that we were having over the last years. So I was speaking about Natalia because she was having a comment on what you were saying, especially on the posture habits and the functional habits and how they are linked. And there she was congratulating you on the fact that it is very important to always speak about that and make the link between the posture and the tongue posture and functions in general. Usually, many people are only focusing on what's happening in the mouth, and the point of doing so many long researches and also having founded the Holistic Academy of Dentistry is to look at the patient.
When you finish the dental school, you are very concentrated on the teeth. But after, the life is different. So you see that it is not all, the life is not only teeth, but there is much more around. So thank you for your comment.
Well, with pleasure. We thank Natalia that is watching us in live. And that's exactly the reason why, even though you are a very experienced practitioner, it's always so important to continue to train yourself. And we are very glad to have practitioners like you founding the Academy of Holistic Dentistry, for example, to highlight the importance of not only looking at the mouth of the patients, but looking at the patients as a whole body. Thank you so much, Dr. Pellegrino, for coming to visit us here.
Thank you very much. It was a really interesting experience, and I hope to have given the opportunity to see and to think in a different way.
You clearly gave us, and we really appreciate this view and idea on the early orthodontics, which is a topic that really will need more interest, and that's why we are so glad to have you here. People can also check out your scientific articles published online if they want to know more about your work. You can also directly address questions to Dr. Pellegrino after the lecture. Just contact us on contact@froggymouth.com, and we'll share the comments with Dr. Pellegrino. And feel free to ask all your questions to your local distributors, because most of you were registering to this webinar through your local distributors. Always keep in mind that they are there to help you to answer all your questions. I was very happy to have you here at the Froggymouth and Biotech Dental Ortho Studio. Dr. Pellegrino, thank you so much.
Thank you to you very much.